Bismillah ar-Rahman ar-Rahim. Dear brothers and sisters, welcome to Dome Podcast. COVID-19, everyone is talking about it and everyone wants to know the details of COVID-19. But instead of, talking to someone from the public about COVID-19, let us talk with an expert from the medical team about COVID-19. And my guest today is Dr. Abdullah bin Hamoud Al-Harthy. Assalamu alaikum, Doctor.
Wa alaikum salam.
How are you today?
I'm good, thank you.
It's an honor to have you on the podcast.
Pleasure's all mine, thank you.
For those who don't know Dr. Abdullah is a trauma surgeon and intensivist. Did I pronounce it right?
Yes, you did it well.
Yes, and he's the Director General of Khawla Hospital.
Yes.
So, Doctor, welcome again on our podcast. And today we're going to talk about COVID-19. Despite COVID-19 has been around for the past 18 months maybe, still we want to hear the story about COVID-19 from the medical side. The entire world, Dr. Abdullah, was shocked with this pandemic. Nobody expected it.
Yeah.
But maybe the story is different from the medical side. So can you tell us a little bit about that from the medical side? Were you guys expecting something like this to happen as the Spanish flu happened a long time ago as well?
Bismillah ar-Rahman ar-Rahim. Well, thank you again for inviting me. I think I'd be lying if anyone said that we expected what we have faced recently. Of course, as you mentioned, pandemics are not a new phenomena. We've had that starting, at least the ones we know, the plague that hit Europe and took out 2/3 of its population, then the Spanish flu, and they have been plagues throughout the human history. If you believe how civilizations have evolved from, the hunter-gatherers to the agricultural, when human beings started living next to each other and forming villages and towns, it made it much easier for disease to spread, as opposed to when they were nomads and there was distancing between each other. Now, for us, of course, as I mentioned, the COVID-19, which is basically a coronavirus, is not something new. We've had coronaviruses in different forms, even in the last few decades. You've heard of SARS.
Yes.
You've heard of the swine flu, H1N1. Even, I would say, maybe 3 or 4 years ago, we had the MERS coronavirus, which is the Middle Eastern form.
A whole set of them.
Exactly. So it is just another cousin of the corona family. What makes it different this time is the transmissibility. It spread very fast. We are living in a globalized world, which meant that this is no longer a localized problem. What started off in November, and it was around our National Day, November 18th,
Yes.
in China in 2019, has become everybody's problem now. There is no such thing as silos. Shows that it is important for you to help your neighbor. What affects one person would affect the other. And I think, in Oman, we had the good fortune, let's put it in that way, even though, people don't see anything good coming out of COVID, is that we did see the effect of COVID on other countries before we started getting hit. It gave us some time to prepare.
Yes.
I won't say we were perfect, but at least we knew what we were facing. For example, we saw what was happening in Iran and in Italy. And of course, everything that would happen in one country would be broadcasted either through social media or regular media. So this is why we knew what was coming down the line.
And I think the majority of people, Dr. Abdullah, expected that everybody's going to be prepared, everybody's going to know what to do. Yeah. But this is something new. Everybody's learning. And if
Absolutely.
you see in a lot of, or some of the advanced nations, they were struggling. They were struggling to cope with the disease.
Sure.
So Oman, I think so far we are heading towards the right direction. But Nevertheless, talking about this, Dr. Abdullah, when the pandemic started, there was so much rumor
Sure.
in terms of the pandemic, and everyone became an expert on COVID-19. So
Absolutely.
tell us your experience in terms of the medical team. When you hear these stories from, your neighbors, your cousins, your family members, how did it make you feel?
Well, the word expert is thrown so easily. And that's why when you called me an expert, I actually got some chills because I don't see myself as an expert. As you mentioned, I'm a surgeon, and
Yes.
I do work in the intensive care unit where we tend to see the sickest of this. But of course, if you want to speak about virology, you should speak to a virologist.
Yeah.
You should speak to a microbiologist. You should speak to an epidemiologist. And in the beginning of the pandemic, and
Doctor,
even until
sorry,
now,
sorry to cut you off.
yeah.
Why do people in the medical field have these long names?
Well,
they're very confusing.
it takes you 7 to 14 years to study. You have to show that you did something during those 14 years.
So you memorize the
of
name.
course, of course. That's half of what we do in medical school.
Mashallah,
Otherwise everybody can become a doctor, Hatim.
Subhanallah.
No, of course, we use a lot of Latin-based terminology. And once you kind of know how to put the prefix and the suffix, it's so easy. But like any other language, I mean, if I was going to speak Swahili now,
Yes.
for people who speak Swahili, they see it quite easy. But for me,
It'd be French.
It would be French or Latin. As you mentioned, everybody was an expert. Now, the problem with Corona, even though, as I said, it's not a completely new virus that was discovered. It's just another strain of the viruses. We didn't know exactly how this strain would behave.
Yes.
And there was a lot for us to learn. And there was a steep learning curve with the medical field. Now, the problem is doctors, or let's say scientists, when they don't know an answer to something, they will tell you, I don't know. We still don't know.
Yes.
And this is where that void was, where people, claimed to know. You knew that they definitely didn't know the answer. Anyone who would come and say, I've got the answers, you knew they didn't have the answers. Yet technology that has served us quite well was also a downfall because, like we spread the right information in the beginning of the pandemic, everybody now can be their own broadcasting station. And the spread of rumors through WhatsApp or through Twitter or through other social media is uncontrollable. Now, for me...
sorry to cut you off again. No. You mentioned something very important is when it comes to scientists and the medical team, when they don't know the answers, they would say, we don't know.
That's right.
And this gap that is left there for the public, it rises these stipulations and theories
Exactly.
and rumors, and everybody wants to fill that gap, showing that I can say something, I know something.
Sure.
But actually, even in our faith, we are asked to verify and make sure of information before we spread it to others,
Absolutely.
And those who are creating the panic among the public by giving false information. I give an example. I saw a YouTube video during the pandemic, the first year of 2020, and this guy was not a medical doctor. He had nothing to do with medicine. He had nothing to do with the science of viruses or anything. And he did this video and he says, you know what? You have to shake people's hands and you don't wear a mask. Sure. And you don't take, vaccine and you don't do this. And when I met him and I said, you're not a specialist in this area. Why are you... If this is your personal conviction, keep it to yourself. But don't spread false information to the public. And that's what happened in the rest of the world as well.
Well, it's the fear of the unknown. That's the thing, that nobody wants to... When you don't know something, you feel like you don't have control of it. And this is why conspiracy theories very popular because it does give you an answer to something that you feel is out of your control.
Yes.
Now, we didn't know, for example, how long this virus was going to stay with us, where did it come from, but a conspiracy theory gives you a very simple answer to something and makes you feel that, oh, now I know. So, for example, the whole idea of that somebody drank or ate bat soup, and that has caused what we are facing now. Or let's say blaming a population, like saying that, oh, the Chinese, it's because of their lack of hygiene and so and so, gives you an easy target to blame. And that also takes the blame off you and gives you an answer to what you're seeking, you know. I can't tell you how many Friday lunches I have to sit around and
you had this debate with family members?
Yes, until, you know, they realize that, you know what, let's not talk about it when Abdullah's home. We'll wait until he leaves, then we'll bring it up. But of course, I try to correct the information as much as we can. But as we said, you know, unfortunately, and I blame us, the medical field, that we need to learn how to communicate with the community. We need to engage with the community and answer their concerns as opposed to just bark information to them. Because the whole idea is not just to tell them what is on my mind.
Yes.
It is for him to get convinced and change behavior. That is where education is. It's not a question of just information, it's education.
Dr. Abdullah, hold your thought. We'll go for a short break and come back very soon, inshallah.
Inshallah.
Welcome everybody back to Dome Podcast, and we have today Dr. Abdullah Al-Harthy. Welcome back, Doctor.
Thank you.
Now I want to talk about Hola Hospital, you being the Director General of Hola Hospital. But before that, I want to ask you a personal question,
Sure.
which is a very common question to all doctors. You have been to medical school for so many years. You have been practicing as a surgeon. Now you are more like an administrator, more doing paperwork. How does that feel?
Well, you're very nice saying like an administrator. I am an administrator, or how some family members would like to say, now I've become a pencil pusher.
MashaAllah.
But for me, I retort and saying, yes, I am a pencil pusher, but I hold the biggest pencil in the hospital. So things were.
Alhamdulillah.
So yeah, you're right. We definitely train for years in medical school, then we go for a residency and a fellowship, and it feels like such a long time ago. And, if you ask any surgeon where is he most comfortable or where is he most happy, we all say that the operating room is where we're happy. And
chopping people up.
Well, we try to stitch them after we chop them. We try not to leave them open, yani. But it's true. It actually does bring me calmness being in the operating room or in the emergency department. So the question is, why do you leave something that you love so much and go into something that, for me, is literally just having a big headache? When I tried to explain it to my son, I was like, well, we spend all these years trying to treat one patient at a time.
Yes.
Or, if you want to make it sound grandiose, save one life at a time.
Yes.
And when you become good at it, then you start teaching others how to save one life at a time. And that's how we evolve from being doctors to becoming teachers.
Yes.
And the profession of medicine is very closely tied with teaching.
That's right.
Once you become a good teacher and you've taught generations, then the next step is trying to fix a system. So now you no longer think of just the individual or your hospital, but you try to see how can you fix a population. And to do that, that's when you start developing systems. And to be a developer of systems, you have to be in the administration. So that was my incentive, even though I really don't like the desk job. But I hope, hopefully when I'm done with my position and I leave, people say that I was a positive value and we try to improve the system.
For sure you are, Doctor.
Yeah.
Now, let us talk about the national response to COVID-19 in terms of Hola Hospital. I'm sure Hola Hospital was very busy from the beginning,
Yes.
and then COVID-19 came. I think you are the only specialized hospital in terms of what do you call it? Bones?
Trauma.
Trauma,
orthopedics? Yeah, okay.
accidents and
Sure.
things like that. So,
Yeah.
how is it like?
Well,
COVID-19?
it definitely was challenging. Now,
Yes.
it was everybody faced their own set of challenges. And, there was a phrase that was very popular during this pandemic, which is we're all in the same boat.
Yes.
Well, we weren't in the same boat. We were in the same storm. And each of us had a different boat.
Yes.
Those had speedboats, some had yachts, and some had, life rafts.
So, what did you have in Holos?
I had actually a good sized boat, but
Yes.
it was more of a military boat, not as a rescue boat.
Yes.
So let me put it this way. So Khawla Hospital is the National Trauma Center.
Yes.
We are also the National Stroke Center, and we have a large department with obstetrics. So these are our three main pillars. For trauma, of
What's
course,
the word you said?
obstetrics.
Forgive
Pillars?
me, but you'll have to explain some of these words.
Sure.
What does it mean?
Which word? Because I said
ob-
obstetrics.
Obstetrics.
Yeah, I'll come to it.
Okay.
So for trauma, basically any injuries, whether they're intentional or let's say accidental, even though we don't like to use the word accident, would require a lot of surgical specialties to manage that patient.
Yes.
So that's why we're very strong, as you mentioned, in our orthopedic program, our plastic surgery, burns unit. We are the major burn center in the country.
So people are referred from all over the Sultanate
Exactly.
to your hospital.
Yeah, Khawla Hospital plays a dual role. One is it serves the needs of Muscat
Yes.
region as a secondary level, but we also work as a tertiary level for the whole country. And even though we have partners like the Armed Forces Hospital and the University Hospital that do offer similar services, we are the main referral center for trauma. For strokes, of course, any internal bleeding in the brain or a thrombus blocking the brain, we are the center in Muscat, and we have similar sister institutions like in Suhar, Nizwa, Sur, and Salala that are the emergency response to try to minimize the effect of the stroke and help with the recovery of the patient.
Is there a
Collaboration?
Collaboration with
Absolutely.
all the hospitals?
And Khawla Hospital is considered, let's say, the anchor of the system because we have the expertise. And not only do we work with our colleagues, but we are a training center for their needs. We try not to have these barriers as much as possible, and we allow cross coverage of these institutions. Now we come to your word, the obstetrics.
Yes.
Yeah. Okay. So obstetrics, and I think, if I'm not mistaken, you were born in Khawla Hospital.
Yes, I was.
Okay. So basically, obstetrics is the treatment of pregnant women. And
You have a
maternal
new unit,
healthcare.
I think, now. A new section for...
Well, we have the
maternity?
outpatient department.
outpatient, yes.
That is where we provide proper antenatal care. But we also have one of the largest neonatal units for children who are born, let's say, prematurely or might need have extra care after being born. And we do share our expertise with the Royal Hospital.
MashaAllah.
And we're very proud to have you as one of our births.
Well, I would like to say this on air, Dr. Abdullah. I would like to thank you and the medical team in Khawla Hospital because you gave me life twice. I was born in Khawla Hospital, and in the late 90s, I was in a coma for 4 days.
Wow.
In the ICU. I was bitten by a snake. And mashallah, by the grace of Allah, you brought me back to life. So thank you very much to everybody in Khawla Hospital. Now, when it comes to some of the challenges, Dr. Abdullah, I'm sure when you are planning for something, you're expecting something, then you can accommodate, have more beds, have more staff, and so on. But when COVID-19 hit in, it was very difficult to manage because you already have patients.
You're right.
You already have people coming in on a daily basis, and the schedules are full. So how did Whole Hospital manage? I would say this chaos.
I hope we did manage. All I know is that we did our best. Now, as I mentioned, the specialities that I mentioned,
Yes.
you will notice that a lot of them are surgical specialities.
Yes.
They are not targeted to infectious disease. They are not internal medicine, where that's was the majority of the needs of COVID patients. So for us, the challenge was, this is not, as I mentioned, this is not affecting only one region. We know that this is going to spread. We need to be part of the solution. We can't depend on only one hospital. They can't carry the load by themselves. So we knew that we would be involved in the treatment of COVID, especially those who are really sick. We were blessed with having one of the largest intensive care units in the country,
Yes.
but they were catered to the diseases that I had mentioned.
Yes.
Now, the issue was, how do you retrain your staff to manage a completely new disease for them? It might not be
And the
new.
procedures are different, I think.
Very, very. And, this is an infectious agent. People who get injured in a car accident or, like, say, falling from height, you deal with the patient. You're not worried to catch anything from them, and you're not worried about the patient lying next to him catching something from him either. The injury has already happened. The damage has happened. However, with COVID, the damage is continuous, and not only is the patient at risk, the other patients around him are at risk, and the staff are at risk. So that put a whole set of challenges on us. So, of course, the other challenge was that, okay, you have COVID, which is a new disease that is putting a big demand on the healthcare. However, the original illnesses you were treating did not disappear. People were still getting accidents.
People are still waiting.
Yeah, they're getting strokes.
Yes.
Especially the emergency ones. They are getting strokes, they're getting accidents. People are still having children. So
more than the usual.
Yeah, well, that's one of the downsides of being locked down. So
I think we lost a lot of loved ones, and new members came to life. Alhamdulillah.
Alhamdulillah. So the key point was on retraining your staff, because we knew we had to expand. We couldn't just suddenly now say that this 30-bed ICU will be dedicated to COVID, because you had to still maintain the capacity to deal with your original illnesses. That meant expansion. Now, a critical care unit is not like any regular ward. It requires specific expertise, not just the doctors, but what even carries it. The equipment, but the human resources is the most difficult element. It takes you years to train people to deal with critically ill patients, and we had to do it in months. So we had to recruit people who had similar to critical care expertise, like nurses in the emergency department, nurses in the operating room, and we had to divert these resources to the expansion of the critical care. Now, that meant that the operating rooms had to shut down.
Yes.
And as you said, there was demands on us. Now, we were doing approximately 4,000 orthopedic cases a year, operative cases a year.
Mashallah.
And we had to drop it to 2,000. Now,
That's half.
And that meant that people who had, for example, osteoarthritis, pains in the knees, the elderly require...
So it was as per the severity of the case. How
for example, our main priority was to maintain emergency capabilities.
Yes.
So if you showed up to our emergency department and you were seriously injured and you needed treatment, we guaranteed you were going to get that treatment.
Yes.
That was our first mission. Now, those who suffered were those that didn't have that life-threatening injuries or limb-threatening injuries. So everything else that we in the medical field called elective, which means non-urgent, had to be delayed. When this pandemic started, we thought we were delaying surgeries for 8 weeks. And for Khawla Hospital, delaying surgeries for 8 weeks is a big deal. But we had to delay them now.
And now is what, 18 months?
It's been 18 months. We every time the wave comes down and the numbers come down, we re-establish these services as soon as we can. The only problem is that with every wave, there is side casualties, as we call it. You
That's
lose
right.
staff, you lose people get sick, people get burnt out, and they decide not to continue with you. And so, for example, right now we are back to almost 80% of our capabilities prior to COVID.
Yes.
That means there's a lot of backlog of certain cases. As I mentioned, orthopedic, for example, 2,000 cases a year have been delayed. So that makes it almost now, we have 4,000 cases on our wait list.
Waiting.
And plastic surgery, people see plastic surgery as only cosmetic surgery, but no, they are plastic and reconstructive. So a lot of patients who have burns and deformities,
They're waiting for that.
they're waiting for that. And children who have birth defects,
Yes.
like the cleft palate and cleft lip, have been delayed. Unfortunately, with the children, what is considered non-urgent in the beginning becomes urgent
Later
with
on.
time, because we have to fix these deformities before they start speaking,
Yeah.
and to also help them with feeding. So this is where you're kind of caught between a rock and a hard place, as they say. So you want to operate on them, but you still need to cater for COVID.
I think the other thing, Dr. Abdullah, is that the media has not been, sharing the stories, the detail of the stories in the hospitals, so for the public to understand. Because for me personally, I might know that the medical team is going through a lot of pressure and challenges, but the details that you're sharing with us today are very important for people to appreciate what is going on behind the scenes, and the people in the medical field who are struggling, who are sacrificing their time with their kids to save lives. I think people need to know. People need to know, and that's why maybe in the future the Ministry of Health should have like their own dedicated media team to cover these stories, because these stories are very emotional and people appreciate. And then instead of having a patient coming to your door, very upset, very aggressive for the long delay of his appointment, but when he sees the actual cases which are more urgent than him, then they appreciate this. I want to take you through a roller coaster, but let us take a short break.
Sure.
And come back inshallah and talk about the next point bi'idhnillah ta'ala.
Inshallah.
Dear brothers and sisters, welcome back to Dome Podcast. And with us is Dr. Abdullah Harthy. Welcome back, Doctor.
Ahlan bik.
Doctor, during the pandemic, I lost 2 loved ones, 2 relatives. And it was very difficult for us to digest the idea that you couldn't see your patient or your relative or loved one for a month or 2, and then they pass away. You can't be involved in the rituals of preparing them for the next life and so on, to bury them.
Yeah.
But what about the medical team who are going through this I would say trauma every single day? You have patients, you cater for their needs, and then suddenly they're gone. Mentally, how do you overcome that?
I wish I had the answer to that, but what I can say is that that has been really tough. This is something very new for us. I remember before the pandemic, people would always ask me with my specialty, how can you do it?
Yes.
How do you break bad news? And, we had that sense that as long as you did the best that you can, and you communicated that to the family, there was a closure and there was an understanding. Loss is loss, but the way you lose somebody is matters. So what happened with this pandemic, first of all, the numbers were quite big. Now, it's almost like being in a war where people who are not directly affected by the loss don't see human beings. They just see numbers.
Yes.
And that's why we were reaching to a point where we were losing 50 people a day in this pandemic at the height of it. Now, 50, they don't die in a group. They are individuals.
Yes.
This is somebody's father, somebody's mother, somebody's sister.
Yes.
You know, they had a life. They were an engineer, they were a doctor, they were a bus driver. This is an individual that you have lost, and he has a family.
Yes.
And that's 50 families a day being orphaned or widowed. And this is where people who were in the front line were seeing this loss on a daily basis, and it was breaking their spirit. And what was breaking their spirit was not only the sense of helplessness, for example, as in they do their best and would still lose that person after a week or 2 weeks of intensive care, but what would hurt us the most was the insensitivity of others, where they only cared about how it affected them, as in, why am I not allowed to go shopping after 8 o'clock?
Yes.
Why am I being forced to wear a mask? Where individual rights trumped more than the public good.
Yeah.
This is what hurt the medical team the most. And what was even worse are people who would claim that these numbers are false and would say that Corona was a conspiracy and that it didn't exist and that we were jeopardizing either, businesses or, I want to travel during the summer and you're preventing
stopping me.
Yeah, so it was tough. It's tough for people. I know it affected everybody.
Dr. Abdullah, I'm sure you have some stories that passed by during this pandemic, these sad moments. If you allow, please, can you
Well, there's
share
so
a few
many.
stories?
I mean, first of all, I definitely want to thank my team. And I want to thank everybody. And I'm not talking just about doctors and nurses. There are a lot of people behind the scene that cater to sick people, including...
I would like to call them the real heroes.
They are. And I'm blessed to be sitting here representing them. However, the real work is done by them.
Yes.
And they start from, the most expert intensivist to the person who gets the least amount of salary, who is the medical orderly or the cleaner. I mean, if the cleaner doesn't do his job, the infection would have been thousands of what it was. The person who fills up the hand washes and the hand sanitizers for you not to get infected, all of them are heroes. And yes, maybe they are not in the limelight, and maybe their job is not as glamorous. You mentioned my whole title in the beginning.
Yes.
Maybe their job description is not as fancy as mine.
Yes.
However, everybody was important. Everything mattered, especially during a pandemic. Now, everybody sacrificed, but some sacrificed more than others. And maybe if you remember in the beginning of the pandemic, when there were lockdowns of Matrah,
That's right.
and Muscat, and then the whole Muscat
Governance.
governorate, and the governorates were separated from each other. We weren't sure how long this was going to last. And we have also healthcare workers who work in Khawla, who live in Darset, or live in Matrah, or live in Rui. And we were worried that if these lockdowns continued, they might not be able to come and report to work, or they might get sick. And so these people chose to leave their families. They left their homes. They didn't leave their homes just to come and do a shift. They left their homes for months, and they lived in dorm-like situations. It's a room. Some of them had share bathrooms, even though we tried to avoid that, but we had to work with what we had. And they left their families for months, their children, their husbands.
Knowing that their families might be going through a difficult time
and
with
that's
the
what
lockdown.
happened. Some had family members who got sick because they are part of the public.
Yes.
And they are torn between giving the health care to their patient and taking care of their family. Now, this is not an infinite resource. As I mentioned, human resources was our most difficult and most precious resource.
And I
Every
think,
nurse we would lose.
Doctor, this
Yeah.
proves that people working in the medical field, it's not a job. It's the heart. You
It's a
either
calling.
have you either have the heart to do this, or it's just gonna be like any other job which you're not gonna be good at.
Well, I hope, again, I do have children, and I do hope that anyone who does any job does not see it as just a way of making money. Of course, money is important, and we all need to make a living. But if everybody saw their job as a calling and that they had to do the best they could, it makes a difference. If you believe what you do is important, you will definitely put effort into it. If you feel that you are of no added value and whatever you do
Yes.
doesn't matter, then why are you there? But yes, definitely these people did their best because they believed that they had a higher calling.
To complement what you're saying, Dr. Abdullah, there are a lot of volunteers during the time of the lockdown of Matrah who left their families and risked their life
Yes.
and went to send food supplies and medicines and help out during the lockdown of Matrah. And I say that we have heroes from both sides. The medical team who left their families to do the bigger call.
Sure.
Yeah. And the people who had nothing to do with this, they could have sat in their homes comfortable, being safe with their kids, but they chose to leave their loved ones and go and sacrifice their lives to be the family of those who were, confined in Matrah. So we salute all of them.
All of them.
May Allah
All of
bless
them
them
are
all, yeah.
essential workers who lahum al-ajr, inshaAllah. I mean, the baker that would go and bake and make sure that we had
Yes.
bread, the grocery shop owner, the garbage collector, all these people were important. And that's why they were called essential workers.
Yeah.
Now, the problem is we never saw them as essential until the pandemic hit,
Yes.
when we started having to select who should go to work and who should stay at home. And we realized that it is bigger than we actually think. A community does not thrive with just select people.
Doctor, the mental health of the medical team is very important, and I'm sure this is one of the challenges that you might have had, or you're still having at the moment. How do you manage to talk to your colleagues and comfort them and make it easy for them to digest what is going on and for them to be patient and to carry on this wonderful work?
Actually, I'm sorry, I digressed a bit from the last question. What was unique about this pandemic, as you mentioned, when you would lose somebody and you would not be able to be by their bedside or bury them. And these things are not just important because they're part of culture,
Yes.
but it is psychologically important as in part of the closure.
Yes.
We are part of the community. We have lost people. We have lost relatives. And I will tell you now, 18 months later,
Yes.
sometimes I'm sitting at my home and I think of certain individuals in my family and I'm like, I'm not sure if this person passed away or not, because we did not bury them and we did not attend their funeral. Usually you have the 3 days for
That's
it to
right.
sink in.
Yeah.
And sometimes I have to call my mother and wonder, I'm like, it might sound like a strange question, but is my auntie so-and-so still around? It is definitely very strange, very weird. Of course, our colleagues in our healthcare workers who work in the mental side and the psychological aspect, from the beginning of the pandemic, realized that this was going to be a challenge. And I have to be thankful for them that they did reach out to us. First to the actual staff, because they were going through more stress than anything.
Yes.
You're asking people to run away from a disease while you're asking these people to run towards it. And the fear is not for one's own safety, but the fear is that you might carry something home to your family. And you might cause your family to be affected.
And I'm sure maybe there are some cases
They are.
that this has happened.
They are, even though we have been very vigilant, especially the infectious disease teams, about educating the healthcare workers how to be extra precautious
When they go back
when they
home.
go back. And so we also have had a few NGOs that work in the mental health industry that have reached out to us and have created, for example, support groups, and they have created telephone numbers that you can
Yes.
call and anonymously, vent. The only problem is that at the peak of the wave, where you need that support the most, you don't have time for it. You just keep thinking of how to,
Save
lives as much as you can and do the best you can. And I will say that we're not very good about the life-work balance, unfortunately. We could do better. This whole concept of breaking and needing help or support is considered a sign of weakness. That I'm glad that with the years
It's
it's
a
changing.
stigma.
It's a stigma, and it is changing. I will say that the newer generations are better at it, about asking for help.
More
and,
accepting.
And yeah. Well,
Uh,
you remember being a boy in Oman, you're not
Don't
allowed
cry.
to cry.
Don't cry.
Exactly. So,
Dr. Abdullah, the preventive measures set by the government for COVID-19, some of the individuals in our society neglected those measures and thought that this is nonsense, this is not important, or I know better, which caused a lot of more cases and more pressure for the medical team, and maybe the loss of more lives. I want you, from the medical point of view, to look at the camera and tell the public, what did that mean to you as the
Sure.
medical team?
of course, نحن, we have to appreciate that, let's say 99% of the public did help out.
Yes.
We can't, the only thing is that what we would see usually are the ones who did not follow the rules.
Yes.
But they are definitely not representative of the majority.
Yes.
And only with the help of the 99% do we find ourselves now where we are, alhamdulillah, in a much better situation. If the public was as bad as we kind of claim they are, we definitely would be in a very different world today. So I, first of all, want to thank the 99% that have followed the rule, that have done their best. Now, with regards to the 1%, human beings are very complex. They're not robots. You can't just punch in a few numbers and they follow that program. And maybe I might give 3 individuals the same information and they interpret it very differently.
Yes.
I come back to the word education. We always claim that we educate people, but we don't. We supply information. Education means the person takes the information, processes it, gets convinced, and changes his behavior.
Yes.
And changing human behavior is not simple. Yes. So I think we can do a better.
What could have we done better?
Well, you can always do better.
Yes.
I think we did very well, but we can always do better. Now, we could have done better, I think, in responding to rumors and giving answers. But as I said, sometimes we didn't have the answer, and people don't want to hear that we don't have an answer. And, rumors sometimes were, let's say, more appealing, more sexy to talk about, as opposed to a boring scientific lecture.
That's right.
I think we could definitely have supported each other better. And as you said, we could have humanized the suffering of COVID. I think we got focused at one point on numbers a lot.
Statistics.
Yes. And, human beings are not statistics. I mean, people who die as individuals, as I said, people who get sick.
Yes.
What are the consequences of people getting sick? Not just on them, on me, on my neighbor, on the economy. It's not just numbers. I think stories are very strong, very important. Even false stories.
Very powerful.
Very powerful. Even false stories are sometimes more powerful than the truth.
That's right.
If you have a good story, people will embrace it. They will believe it. I don't think we could have given better stories than just how many people got sick, how many people got better, how many people died.
Yes.
Because when you do that, you lose the plot.
Yeah. Dr. Abdullah, stay tuned. We're going to take another short break and come back and continue our discussion.
Thank you.
Dear brothers and sisters, welcome back to Dome Podcast. With me, Hatim Abdissalaam, and joining me, Dr. Abdullah Al-Harthy. Dr. Abdullah, some of us think that this is a total catastrophe that happened to us. But I'm sure in one way or the other, there are so many lessons learned from this experience. One of the things that I think I would do is tell my grandkids about this whole experience of coronavirus.
Sure.
Yeah, maybe the generations before us or the generations to come, they might not go through what we went through, but we have a story to tell. What about the medical team, Dr. Abdullah? What are the lessons learned through coronavirus?
Well, as we say in Arabic, الخير في بطن الشر. And we are learning. We continue to learn. It might be too soon now for us to have a global picture because we're still in it. I mean, for people who think that COVID is over, it's not over.
People are on holidays.
I know.
People are traveling every single day.
Which again shows you how short our memories are. How we recover very fast.
We're called insan.
Nisyan, which is a blessing sometimes and a curse sometimes. So for us, we've learned a lot of lessons. I can even say that we've learned lessons in Khawla Hospital. Mm-hmm. We've learned lessons nationally, and we've learned lessons regionally. Come back to our first, when I was saying that we're in the same storm. We've learned that, first of all, you can't do this alone. Nobody is strong enough to do it alone. Even, if you are so-called superpower, nations, nobody does it alone. We now live.
We saw people in Europe lying on the streets. Hospitals could not accommodate more people. Absolutely. And these were nations, leading nations. They were known for their technology and advancement in the medical field, but they couldn't manage.
Yeah, so it shows you how fragile human life is.
Yes.
So I think people taught us, humility more than anything.
I hope so.
If these waves continue, we will be taught. And as they say, if you don't learn from this lesson, there are other lessons down the line.
SubhanAllah.
So we realized how interconnected we are. And now we live in a globalized world. So nobody does everything. One of the first things we've noticed, we knew that we needed some medical supply.
Yes.
But no country does all of their medical supplies. Some countries don't make any medical supplies, and they get everything from abroad. But even those, the big nations, realize that they have outsourced everything.
So you mean we need to depend on ourselves more in making the medical supplies?
It's both.
Or have a backup plan?
It's both. So first of all, you have to learn how to cooperate. So for example, the Gulf Council countries, instead of us competing for resources and outbidding each other buying ventilators, because everybody has money and everybody will say, okay, I'll pay more to get it tomorrow.
Yes.
We chose to join our forces together and work as a team.
Yeah.
So cooperation was very important for us. This is on a regional level. The other thing is we realized how the supply chain is very fragile. That, for example, you might have 90% of what you need to build a ventilator, but you'd be surprised that 10% that is missing is probably in some obscure nation you've never heard of. But you all need to work together to make sure that you can achieve your target.
Yes.
Now, if I'm to talk about Khawla Hospital, the flexibility of the healthcare was very important for us. So as I mentioned, we had specific specialities that we were focusing on. But with this new challenge, we realized that we had to retrain our healthcare workers. And
Yes.
having that flexibility is what got us through it. We can be even better, and this training can be introduced even earlier in our medical school or nursing school, or during our residency. So this is one of the lessons we've learned. The other thing is that, for example, Muscat can't be the answer to everything that Oman
We
needs.
have to move out of Muscat and
Absolutely, and especially
have more centers and
Yeah.
more response.
So every governorate
center.
now realized that they have their strengths and weaknesses, and they had to, first of all, cooperate with their neighboring governorates. You can't have everything, so you have to kind of cover each other. But in addition to that, you have to have at least your emergency services capability running, especially certain governorates like, for example, Musandam,
Yes.
where closure of the borders might be a problem for you. And this is where decentralization of the healthcare is very important for us. I mean, yes, certain decisions have to be centralized, but each governorate should learn how to
And I
maximize
think
their
that's
strengths.
the direction of the
Yes,
government
yes.
now, is to have each government to be independent, having their own resources, their own projects, and so on,
Exactly.
to stand
And
on their
again,
feet.
we come to, for example, let's say good fortune, and for example, leaders who have a vision where Oman 2040
Yes.
had started before the pandemic. And parts of, if you look at the healthcare sector, what our vision for 2040, and we had started working on it before the pandemic and has helped us out. And we will continue to build on with the lessons learned from this pandemic is decentralization, sustainability, and
Yes.
that healthcare is not just the absence of disease.
Prevention.
Prevention, and if anything, in this pandemic, you have learned the importance of prevention, starting with, physical distancing, wearing the mask, using hand sanitizers, and then our biggest weapon now, which is the vaccination program.
Talking about people going for holidays, Dr. Abdullah,
Yeah.
recovery from COVID. Are we recovering from COVID? Are they good glimpses of light at the end of the tunnel that we're going to be okay? I'm sure this is a very big question.
Sure.
Nobody has the answer, but at least in terms of our social life,
Yes.
are we going to go back to normal life? Our kids went back to school 2-3
Alhamdulillah.
weeks back, and they're coping with the new norm. So what can you tell us about that, Victor?
Well, even from the beginning of the pandemic, the government has been looking and planning for the recovery. And this is why برنامج تعافي and نحو التعافي is always mentioned in combination to how do we respond to COVID. Recovery sometimes is a bigger task, more expensive, and longer than for the actual problem that has happened. In Oman, I remember my grandfather used to say, العافية بالمثاقيل. For you to get sick, you get sick quickly. But for you to recover from your illness, it takes you time. Same thing with society. There is hope, and definitely we are seeing the hope now, and we are going there. But we also have to make sure that we have learned our lessons and not relive the mistakes of the past to stop us from recovering. Now, I mentioned, for example, the large waiting list of operations in Khawla Hospital. And this is not just unique to Khawla Hospital. All the hospitals are facing it.
Yes.
The ministry is looking into a lot of different options to speed up the recovery.
Yes.
Not only do we want to go back to 100%, because going back to 100% will not help you catch up with the backlog.
Yes.
So involvement of the private sector, for example, longer hours, changing even the way we think of surgeries. Before, you used to go 2-3 days before your operation, you'd stay in the hospital, get your surgery, you wait for 3-4 days before you go home.
So now what you're saying in a nutshell is think out of the box.
In the box, on the box, outside of the box, whatever gives you positive solutions. That's
Yes.
what we want. We want positive solutions.
Okay, I'm going to shift now to a very common debate that people have during lunch and dinner and breakfast and supper and at work and everywhere, which is the vaccine debate.
These people are eating a lot, it seems. Many meals during
Well,
the day.
unfortunately, the only time people debate is when they eat.
True.
So I'm sure people from the medical field, they always listen to these debates and they smile and shake their head. What can you tell the public, Doctor, when it comes to the vaccine? Because, again, there are so many assumptions,
Sure.
so many theories, and some people are still living in that bubble that, no, I shouldn't take the vaccine and it's not safe and I'm going to die and you know that.
Yeah, of course. Well, there's me as the doctor answering, and then there's me as Abdullah Harthy answering.
Okay, give
So-
us the both
Because there
answers.
is the politically not correct answer, but I would rather let's stick with the politically correct.
Okay.
So let's forget about the different types of vaccine, and
Yes.
there are many in the market. The issue is that I find it sometimes surprising that we're okay to take our child for the first 18 months. No, forget it. From the time he's born, and we start jabbing him with injections to prevent
all sorts of vaccines.
all sorts of vaccines. So by the time he is actually an adult, he would have received approximately 12 vaccines.
Yes.
Yeah, different types of vaccines. Some of them are boosters for vaccines he has received earlier. And we don't have a problem with that.
We can't even name those
Yeah,
vaccines.
exactly.
We don't know what
And
they're
you
for.
never actually ask the pediatrician, why are you doing that?
Yeah.
I don't feel safe about that, but you're okay. And we're talking about, these people who are debating the vaccines now are the product of the vaccine program that happened in Oman.
Yes.
Childhood mortality was very high in the 70s. People don't remember that. The average.
What was the disease that was killing kids
Well,
at that time?
Well, there's many.
Was it cholera or?
Well, there's many. There's the vaccine disease. Like you don't see anybody with polio anymore now.
No.
You don't. It's something that we just look in medical books. But
Yeah.
polio, and I am not that
Polio,
old, but I do remember people
Polio is
having
Shal
polio.
al-Atfal, right?
Shal al-Atfal.
Shal al-Atfal.
Yeah. It is still existing. It's almost rare that you see it in Oman. You don't see anybody with those polio look, the leg that is not working. They're on stretchers, and a lot of them had died before. Now for you to have a child die in infancy is a shock to the system. The whole country is like, why did he die? While in the 1970s, the majority did die.
It was a normal
Yeah,
thing.
and that's why our average life expectancy in Oman was 40. It wasn't that people were dying at the age of 40. It was that a lot of children were dying, and that brings your average lifespan as a community lower. So what I'm saying is that people need to look at themselves first before they start preaching. So you are the result of a successful vaccination program. You as Hatim, you as Abdullah al-Harthi, as Omanis. And Allah yarham, I have to mention Professor Musallam al-Buali, who was one of the pioneers of pediatric care in this country. And we just recently lost Professor Bezdawi.
Yes.
Allah yarhamhum jami'an. These people built healthcare in this country, and vaccines were what helped them achieve. It wasn't the medications. Dr. Bezdawi was a respirologist, and tuberculosis was rampant in Oman. You don't see tuberculosis in Oman anymore. It only comes from the outside.
You actually answered the question without answering the question.
Well, I try to be. That's what being an administrator is.
It's very convincing, and you hit the nail in the point.
I would like to say
Yes.
that, first of all, I do understand why people I am empathetic why they're concerned.
Yes.
And it is okay to be concerned because it's a new disease to them.
Yes.
For them, they see that how did we make a vaccine that usually take years? How did we do it within a year? And now we're giving it to everybody and we don't know the results. But they are only seeing the tip of the iceberg. That's the problem. You know, we were talking earlier about how a swan looks very put together and calm over the surface, but
Yes.
the legs
They keep on moving.
keep on moving to
Yes.
maintain that. And this is what the public doesn't see. The vaccine did not show up
Suddenly.
suddenly. This vaccine, first of all, as I mentioned, corona is not a new virus. It is just a cousin of a virus
So
that
the
was well known.
research
So
on
the research
coronavirus was always there.
Exactly. We were dealing with corona from the times of SARS, H1N1, as I mentioned, MERS. So modification of a vaccine of a virus that was already there. So this work didn't happen in a year. This was happening years before corona. Now, in addition to that, they're like, you're giving it to everybody at the same time. Well, for example, if we talk about Oman, we didn't introduce all of the vaccines suddenly. And actually, we were being criticized.
Yes.
Why are neighboring countries having so much vaccines and we don't have it? Why is the Chinese vaccine available? Why is the Russian vaccine available? Because taking these decisions, we don't take them lightly. We never introduced a vaccine until we actually saw what were the results
In
of
other nations.
not only in other nations, but the experimentation. There's multiple classes of experimentation to see the effects of the vaccine.
Yes.
And companies that were transparent and shared the research were the companies that we introduced.
Mashallah.
And we didn't introduce the other companies until they actually shared. So we are actually more worried about the public health than the public. Do not think that, first of all, we this is our mission. Your health is our mission. So I find it very weird when they actually think that we want to do harm for the public.
Yeah, which is not fair, honestly speaking. And even the glorious Quran says, ask the people of knowledge if you don't know.
Sure.
And if we don't trust our own people who are experts in the medical field, who are we going to trust?
But we do understand the concerns.
Yeah.
But there is a point that after you have been given enough explanation and information, and again, realize that this is global, you are no different than
Anyone
the
else?
billions of people around the world. And if something was going to happen to them, it will happen to you.
Definitely. The last point for the day, Dr. Abdullah, is changing our understanding of health role towards the public or for the public. What would you like to add to that?
This needs a whole podcast. And actually, probably I'm not the best person to talk about it because I'm usually a surgeon and intensivist, so I tend to see you when you're at your sickest. But if we took, for example, the trauma part.
Yes.
Now, we've learned over the years that, you know, what we call accidents, 99% of them are preventable.
Yes.
And we've seen the effects of seat belts, for example,
Yes.
and speed limits and speed cameras, that they have actually saved more lives than I have in the hospital.
Yes.
So what we are trying to say is that prevention is definitely better than the cure. And our definition of health has to move on from what do hospitals do and what does a health center do. We need to start as what happens at home and what happens in the school. What food are you eating? What activities are you doing? We need to promote health and not just treat illness. And this is where, again, we come back to the vision of 2040, where we have to give people ownership of their own health. You don't come to me seeking me to save you. You are your own savior.
You're responsible about yourself.
Yes, and that is why our motto is Health is everyone's responsibility. Everybody plays a role in health.
Health is everyone's responsibility. With this, we end today's session. Thank you very much, Dr. Abdullah bin Hamoud Al-Harthy, Director General of Khawla Hospital. Thank you very much, all of you, for listening to this episode of Dome Podcast. From me, Hatim Abdissalaam. Assalamu alaikum wa rahmatullahi wa barakatuh.